Hi, I am Janessa Alvarez. I'm a crisis clinician out of Child Guidance Center of Southern Connecticut. On a daily basis, I work with children and adolescents 3 to 18 that are struggling with mental health crises. But today, I want to talk about the crisis that we're all experiencing. COVID-19 pandemic has been sparking increasing levels of anxiety, grief, and uncertainty for all, children and adults alike. We all know that having our children safe at home with us during a time like this can bring comfort, but we also know it can bring a high level of stress. We're constantly seeing and hearing the news about COVID-19. Think for a moment about all of the questions and concerns that arise within yourself. Now, imagine being 7, 8, even 12 years old and not understanding it all, feeling confused and unsafe, questioning, why can't I see grandma or grandpa? Why is school out? Why can't I go to the park? Children are seeing things on social media and TV, but also hearing things from friends, teachers, or maybe even ourselves. I invite you to have open conversations with your children. Ask them what they know and what they have questions about. How are they feeling about it? What worries them? Questions like these give the children space to express their feelings and help them get back a sense of safety and comfort. So, how do we manage our own worries and fears while managing those of our kids at the same time? So most of us have heard the expression, children are like sponges. Kids can be very in tune with their loved ones and have the ability to soak up the energy and information around them. And children will have questions. They will have concerns. And they will look to the adults in their lives for comfort and guidance on how to manage their own feelings. Some children may have risk factors for developing more intense reactions, such as severe anxiety, depression, and even suicidal behavior. Risk factors may include a pre-existing mental health condition, previous traumatic experiences, abuse, family instability, or the loss of a loved one. Parents should contact a professional if children show significant signs in behavior or any of the following symptoms for more than 1 week. For preschool age, thumb sucking, bedwetting, excessive clinging to parents, loss of appetite, fear of the dark, regression in behavior, and withdrawal. For primary school, irritability, aggressiveness, clinging, nightmares, evasion of school responsibility, poor concentration, and withdrawal from activities. For adolescents, sleeping and eating disorders, agitation, increased conflict, criminal behavior, poor concentration. In addition, I offer the following suggestions to help your child adjust to the changes. Talk directly, but non-judgmentally, to your child about new behaviors you're noticing. If your child is particularly crabby or isolated, do not be silent. Show them that you want to help and that you're curious about the reason for their behavior. Offer reassurance. Remind them of other situations where they may have felt helpless and scared. Remind them that you have been through difficult times in the past, and while everyone was distressed, everyone did work together and overcame the situation. Loosen the rules on time spent on social media within reasonable limits so that your children can make up for lost socialization time with schools closing. encourage them to be creative about new ways to interact with their friends. Healthy habits are particularly important for young people who may be struggling with anxiety or depression. Losing predictable routines can be a source of stress, so try to help them keep a routine as much as you can. And I would say this is really important. Parents, please keep in mind that you can't pour from an empty cup. Self-care is key. Remember to be patient with yourself and use your own supports to get through this difficult time. If you do notice that your child is struggling, contact a mental health professional in your area. You can call your insurance to get the names of providers who perform telehealth or a local child guidance clinic. If you live in Darien, New Canaan, Stamford, or Greenwich, you can also call Child Guidance Center of Southern Connecticut at 203-324-6127 for help. If your child is in crisis, you can always call 211 and press 1 to connect with a crisis therapist. Stay safe and remember, we're all in this together.